Hello and welcome to your new issue of Leaders Talk, which is today focusing on medical imaging solutions for diagnostic laboratories. The digital transformation of diagnostic laboratories is a key challenge for cancer treatments. Current technologies, especially AI, provide concrete answers to the problem faced by laboratories, particularly in terms of workload and complexity. However, only 5% of pathology laboratories are equipped. In order to have more details on these medical imaging solutions, I welcome our guest, Jean-François Pomerol, CEO of TRIBVN Healthcare. Hello.
Hi, thanks for welcoming me.
And thanks for being with us today. So we will begin this interview. Your area of expertise focuses on pathology laboratories. Can you explain what is the role of pathologists?
Yes, pathologists are medical doctors who diagnose complex diseases, and namely cancer. So they do it by studying tissues and cells under the microscope. And they have a key role to understand what's going on complex diseases. And it's essential in the context of preventive, personalized medicine. And pathologists are asked to determine which therapy will offer the best possible outcome for the patient. It's a question of medical and it's a question of economic efficiency.
And what to expect from this market in the coming years? What are the trends?
First, I would say that the global activity of pathology laboratory increase is about 5% each year. This can be explained by the fact that the total number of cancer increases every year, and that the complexity of the diagnosis is also an increase linked with the personalized medicine I was talking earlier. The second thing I would say is that we face a global shortage of pathologists worldwide due to demographic reasons in many countries, and also due to the fact that it takes time to train a pathologist, about 20 years of training and practicing. So if you put all that together, you understand, and you easily understand that a pathology laboratory must change the way they are doing diagnosis and cancer diagnosis. And digital imaging transformation, what we call digital pathology, is a solution to that. So in this market, we expect an amazing growth in the coming years, with a total market for digital pathology of above $1 billion within 5 years.
And what do you mean precisely by digital pathology apply to the pathology labs?
Well, it's simply the capacity that we have to get rid of the microscope and replacing it by a screen. So it's a combination of different mature technologies, which are high resolution scanning, high speed network, and important computational capacity to manage this data. Because just for you to know, one patient case is about 10 gig of data, and every lab which goes digital produce up to 5 terabytes of data each day. So it's really huge. And so it's a true challenge to be able to manage that. What we learn also from the early adopters, I would say, is that it's not only buying a scanner or a screen, it's a complete redesign of your lab organization, of your processes. It's a new way of working and a new balance between technician and doctors, between pathologists and clinicians, and also in relation with patients. So you have to think at a global project, global redesign of your organization.
Okay. And what do these new solutions bring to the medical field, to both health professionals and patients?
First, it's a way to work without having the physical glass slide in hand. So you can work, change a log, because you can work remotely, you can work from home, you can organize telemedicine networks with people far away. So it's the first advantage is much more easy and much more easier and communication between pathologists. The second thing is that once you get a file, a biological file, you can use algorithm to detect, to find, to count, to measure cells and cells abnormalities. So you enter the area of AI applied to diagnosis, which is toward a diagnosis helped by a computer. So these possibilities are, offer numerous advantage for the pathology department. It's a question of productivity gain. You save time of technician, you save time of pathologist, and recent studies have demonstrated that you can save up to 25% of the time of the pathologist, which is huge if you think about the challenge we were talking about earlier. For the patient, it's a guarantee to have a more rapid and more secure diagnosis, which is important in complex therapy like cancer. And for social security, healthcare insurer, it's a way to be sure that the expensive therapies will be more efficient to the patient and deliver the best possible outcomes.
So we understand well the situation and what is at stake, but tell me more about TRIBVN Healthcare solutions and what you are proposing to the pathology labs.
TRIBVN Healthcare is a software company, so we design and develop software solutions for the digital transition of the laboratories. So we have a complete suite to manage, to share, and to analyze medical images. It's a combination of an easy-to-use and fast viewer of powerful workflow management to deliver the right image at the right time in a secure way. And it's, of course, a lot of clinical application fueled by AI. And we do this, we have mainly two products. One is Calopix for the daily lab organization, and one is Teleslide to organize collaborative activities and networks over internet. And both products, they are highly configurable, so we can address activities in the diagnosis field, but also in educational and in research field. And both products are medical devices in Europe and in Canada. And we equip more than 200 customers in those areas with those solutions.
And why do your customers choose your company? What is your specificity on the markets?
You know, we have been working in this industry for many years from now, so we are well recognized as a true specialist of the digital transformation of laboratories. So of course we have very good products and developed with the pathologist, but besides that we are able to provide a lot of services around the products. Like project management, training, support, long-term support. So we have a team with a proven experience of transforming the pathology organization, and we are able to provide a complete solution to accompany them, and I think that's something which is quite unique on the market.
And you have just completed a fundraising campaign. Why now, and what are the development axes you are working on?
I'm happy to talk about that because this is clearly a new adventure for TRIBVN Healthcare. So far we were self-financed, but as you understand, we expect a rising and an acceleration in the market. And we truly believe also that our products, our offer bring tremendous value to the customer and to the pathology department. So we want to grow faster, and we want to be at the forefront of this digital pathology revolution. So about 1 year ago, we met many VCs, and we are very happy to meet and sign with LBO France, which manages the first European fund dedicated to digital healthcare. And they have a seasoned senior team with a lot of knowledge, experience, and relationship in that field. So the 5 million euro funding will be used to develop our commercial activities in Europe and in North America, and will also be used to accelerate our products roadmap. Just one example, I'm very keen and happy to share with you that we were just awarded by Greater Paris region to develop for the development of a clinical AI application on digestive biopsies. So that's clearly the things we want to do, and a way, an approach to make the buzz of AI and medical imaging a true reality for the pathologists, for the doctors, and for the patients.
Thank you for all these explanations about your solutions and the market.
Thanks to you.
And thank you for being with us today. I see you soon on a new Leaders Talk TV program.